Congressman Mike Pence of Indiana is chairman of the House Republican Conference, and some are talking about him now as a presidential contender. He recently visited Iowa. Congressman Pence, good to have you on the show, sir.
Thanks, Carlos. Good to be back.
Good to see you. So, Congressman Pence, I know that House Republicans unveiled a $700 billion health care plan, but when you look at the deal that was struck with some of the so-called blue dog Democrats, is that move closer to something that you think you and other Republicans could get behind?
Look, House Republicans know, what most Americans know, Carlos, is that we need health care reform in this country. But we don't need a government takeover of health care. We don't need what this administration and House Democrats, even with the changes that have been negotiated in their deal, are intent on doing, and that is launching a massive new government-run insurance plan that will literally cost, nearly $1 trillion in higher taxes at the outset, and it will cause tens of millions of Americans to lose their health insurance.
Congressman Pence, unless you're looking at different data than I'm looking at, I don't remember there being $1 trillion in new taxes. I remember the president saying that 2/3 of that would come from savings, and that we're talking about 1/3 of that potentially coming in taxes and other fees. But I just want to make sure that we're clear on that. Are you saying that there are $1 trillion in new taxes as part of what the House is proposing?
I think the CBO estimate of the Democrat bill was about $800 billion and some cost in higher taxes and fees and mandates. So, I think the reality is that we're looking at the launch of a more than $1 trillion government health care initiative by the Democrats. It's going to be paid for by nearly $1 trillion in higher taxes on small businesses, on individuals.
But
and, the Wall Street Journal today pointed out, what was it, like a 10% increase in payroll taxes?
Representative Pence, I apologize. I've got to interrupt you just to be clear about this, because it's a significant point. And unless please feel free to correct me if I've got incorrect data here. I'm very clear that we are not talking about anywhere close to $1 trillion or $800 billion in new taxes. So if you've got data, including from the CBO, that suggests that some of the proposals on the table, including what they're talking about in the Energy and Commerce Committee, represent that much in new taxes, then that's significant new information. Where are you getting that from?
Well, I don't think that's significant new information. I think the estimates that we've all been working with from the CBO are in the, I'm trying to remember, it's about the $800 billion range in the estimated costs of new taxes, surtax on millionaires they've talked about, the increased taxes on small businesses, the 2% payroll tax. That's really all out there, Carlos. But the reality is that the core problem here with the administration's plan and with the Democrat plan, and even with this so-called deal the Blue Dogs have launched, is that they simply won't give up on launching a massive new government-run health insurance plan as an option to so-called compete in the private sector. The reality is if the federal government introduces a free government health insurance option, tens of millions of employers are going to cancel the insurance that they offer their employees. They're not going to pay twice for it in the form of higher taxes and the cost of the health care. They're going to send them to Uncle Sam and do what they need to do to keep the lights on and the doors open at their business.
Congressman Pence, I want to bring in Carrie Eleveld, who's joining me today as my guest co-host.
Hi, Congressman Pence. Just a question here. The Blue Dogs are really making themselves felt in this debate. They have been able to sort of walk back the really progressive Democrats a little bit. Do you feel like in some ways the Blue Dog Democrats are sort of usurping Republican power in this negotiation?
Well, let me say first, I really commend the Blue Dog Democrats who have taken a stand against their own leadership. At least up until today, we saw some very strong opposition to the extraordinary cost of launching this government-run insurance program. It is, I know, disappointing, though, Carrie, to tens of millions of Americans who oppose a government takeover of health care to see the so-called deal that's been introduced today. I mean, they're $100 billion in trimming the costs and excluding a few more businesses while you're still launching a government-run insurance option really is just slightly less of the bad idea that the American people are not buying here.
Congressman Pence, we've got to go, but have to ask you quickly in 30 seconds, how seriously are you thinking about a possible presidential run? Folks tell me that you've been visiting Iowa and other places and that a number of the GOP insiders have been talking to you about considering it.
Well, it's a nice compliment, Carlos, but let me tell you, I was in Iowa a week ago. I've been in North Carolina, California, Kentucky, Ohio. I'm focused on serving the people of Indiana and electing as many conservatives to Congress as we can in the year 2010. I have no other plans than that.
Congressman Pence, I appreciate that. Good to have you join us. Look forward to having you join us again.
Thank you, Carlos.
Thank you.